We are live.
Good evening, everyone. I am Dr. Sejal Naik, Endoscopy Committee Chairperson, Fogsi. Welcome you all for this unique initiative by our visionary President, Dr. Sunita Tandulwadkar, Gyan Pravah. I welcome you all for this 253rd episode of Gyan Pravah. It's 8 p.m. On 8th of every month, I come here to welcome you all with a very legendary and renowned endoscopist for this endoscopy committee program. Today we have Dr. Sanjay Patel sir. And before I start anything, I would like to have some little bit information and introduction of our Sunita madam. Let us take a moment to honor this extraordinary leader who has envisioned this Gyan Pravah, a series of podcasts and the interview where the river of wisdom connecting hearts and minds and knowledge through the generations. Our beloved President Foxy, Dr. Sunita Tandulwadkar. She is not just a name, but a movement of passion, purpose, and progress. A woman who lives each moment fullest and relative with all the positivity and leads with the boundless energy and grace. She has uh, achieved many golden milestones in the Foxy, many landmarks initiatives she has started during her presidency. One of them are the Sampurna, the holistic approach for the comprehensive women care and preconceptional care. Know Your Numbers, where empowering women through the preventive health care. Do Tike Zindagi Ke, where the championing the cervical cancer vaccination and prevention in the India. Anubandh, while strengthening the bond between each Foxians and the societies with the as a Foxy family. Eagle Project, where soaring towards academic excellence and leadership growth, and the intellectual jewel that is this Gyan Pravah. Now, nearly this is today is the 253rd episode, and we are still on every day 8 p.m. हर मंत्रा is स्वस्थ नारी समृद्ध वतन हर घर Foxian that reflects not just a vision but a mission where every initiative aims to empower, uplift, and celebrate the strength of womanhood. She has refined leadership by creating many more leaders and proving that compassion can be powerful, innovation can be inclusive, and that when a woman leads with heart, the entire generation learns to soar. So we miss you here, madam, as there at Figo at Cape Town. And we have dynamic joint secretary, madam's right hand, Dr. Ashwini Kale here. She is from Asha Kiran, director of Asha Kiran Hospital, Pune. And she has given her heart and soul to the all the madam's activity. And that is, she has the power to connect each and every one of us, whether it's Foxy office, the chairperson, vice presidents, or the entire Foxy managing team. She has one-to-one, heart-to-heart connection with each one of us. So we welcome you here, and we really miss the heartbeat of Foxy, Dr. Sunita Tandulwadkar here. And with immense pride and heartful admiration, I request Dr. Ashwini to have the welcome address.
Thank you so much, Sejal, for the lovely introduction. A very warm welcome to you, Sanjay sir. It's really an honor for us and Foxy as well to have you here. I must say that we're really missing Sunita madam today. Otherwise, each and every podcast, she makes it a point to join. She has not missed a single podcast unless and until either she's on the stage or in the flight, as she truly says. And we are very proud that today she is making a global mark at Figo, Cape Town, making Foxy even proud. I mean, she's not only a leader of inclusiveness, but now it's a leadership of planning and execution of all her Sampurna project, which is going globally now, with Foxy as the pioneer under her leadership. So we are really very, very proud that she's been our mentor, a common mentor for me and Sejal through all the Foxy activities. And I must tell you, Sanjay sir, that Sejal is doing so well with her Eagle project. This was one dream of Sunita madam, where Sejal has given it wings and it's flying so high that we've finished over 100 Eagle projects across the country now, where every postgraduate is exposed to this laparoscopy. They know now what hysteroscopy is, what laparoscopy is, and how to approach the surgery. Probably, I think by the time Sejal becomes the IAG president, the postgraduates would be doing more laparoscopy than normal deliveries. Each and every postgraduate is so passionate about this, and she herself actually takes all these projects to her heart, and each and every project is monitored and mentored by Sejal. Heartiest congratulations for the wonderful initiatives under Madam. So I leave it
Thank
to
you.
you. I'll send from the viewers link. Wishing you all the best for the podcast. Thank you so much, Sanjay sir, for being with us here today.
Thank you, Aswini and
Thank
Dr. Sejal. Thank you very much.
So, before we start our conversation, I would like to introduce today, and that is my pride privilege to introduce Dr. Sanjay Patel, sir. It is true honor today to welcome you here in to this platform, a surgeon, a teacher, a visionary who has transformed the landscape of gynecological endoscopy in India, Dr. Sanjay Patel, Director of Department of Minimally Invasive Surgery in esteemed Mayflower Women's Hospital, Ahmedabad, a true pioneer. Dr. Sanjay Patel was the first gynecologist in Asia to perform the laparoscopic Vardim hysterectomy way back in 1997-98 when I was a medical student, and a milestone that placed India firmly on the global map of advanced endoscopic surgery. He is also among the first in India to perform bowel resection and anastomosis in endometriosis, settling new standards in complex pelvic surgeries. With the latest series of tubal microsurgery and adenoma resection in the world, Dr. Sanjay Patel's contribution to the field goes beyond scale. It is an entire legacy built on the precision, dedication, and innovation. So his excellence has been recognized internationally. He was honored as a professor by EGES Italy and has served as a course director of Apache through these numerous workshops, live surgeries, the lectures across the world. He has become a true ambassador of Indian endoscopy. As a trailblazer and mentor, trainer, he has been shaping future generations since 1998 and having trained over more than 2,000 gynecologists in basic and advanced endoscopic surgery, spreading both skills, knowledge, and spirit across the India and love towards the endoscopy. His outstanding contributions have earned so many accolades and the awards like Junior and Senior Fogsi Korean Awards, Suili Rudra Sinha Award for the Best Paper, Damayanti Ganatra Awards, Esculap Golden Telescope Awards, the Platinum Telescope Award, Excellence in Medical Field Award by IMA, Best Gynecological Hospital Award by India Healthcare Awards, and then Lifetime Achievement Awards at Rage Conference, Bangalore. Beyond the awards and milestones, Dr. Sanjay Patel embodies passion, precision, and progress. A man whose vision contributes to inspire whose hands healed countless women, countless lives. Today, we celebrate not just a surgeon, but a true architect of modern gynec endoscopy, a teacher, a trailblazer, and a torchbearer of excellence, nothing else. Join us for the warm welcome of Dr. Sanjay Patel, sir, my mentor, my inspiration, and forever motivation. Thank you, sir. Thank you for being here, and it is really our honor to have you, sir.
Thank you, Sejal, for the kind words. Actually, I am the most discarded guy in the field of medicines. This is the true story.
No, sir.
Eh?
Sir, we have seen you and we have learned you and we are still learning and we wish to continue learning. And even if we become a 10% of you, what you are, we feel our life is worth having. So, sir, as this podcast, we are discussing about your precision, passion, and progress. So, I would like to start the conversation with like, how did you incline towards the medicine or the gynecology? Were you like it is by choice, by chance, or just by accident?
Actually, of OB&GY is not the choice of my subject. Actually, I want to do the surgery, but my father is forced to me to do the OB&GY, and that's why I enter in the MD, Gynec. Once I finished my MD Gynec, I spoke with my father. I am not keenly interested for the obstetric, so I leave these professors. And then I am couple of months in the diamond market at Pachratna. After a couple of months, one day my father is ring me. If you don't want to do the obstetric, better you start the some. I read the one article related to keyhole surgery, and I think let's you start it. And this is the one of the step I pick up. This is the laparoscope, and I started my journey with this laparoscope in 1992, 1993.
So once upon you have quit the obs and gynae and were into the diamond business.
And again, I come back to the medical professors.
Oh, so that is what the healing hand is. Many of the fortunate women would must have like without you, what would be their life that we can imagine? Sir, maybe more money in the diamond and more, the life for the easy, less stress-free life, maybe in the any business. But do you feel that what you have took the decision at that point of time is worth taking this
Actually,
gynae time?
Sejal, I couldn't know the future of this keyhole surgery. But once I do the couple of cases, I find out I need the patience toward this. जो 3 इडियट्स, अगर अपना काम काम नहीं होता वो गम्बत बन जाता है. कभी कभी इन योर प्रोफेशंस आई थिंक यू चूज द वन सब्जेक्ट. दिस इज योर हॉबी, and if you involve in this hobby, I think this is not the work for you. This is the same things is happen in my life, and I think laparoscopy has changed the entire scenario of my life. Second important
So,
part, yes, tell me.
no, so what, like your father has like suggested you or shown you something that is new upcoming thing, and your eagerness led to explore more. But what actually inspired you towards this very challenging branch at that point of time, gynec endoscopy? So,
Ideally, at that time, the majority people is do for the fertility enhancing surgery, and one of the surgery is the tubal microsurgery, and do the adductolysis and restore the anatomy, and more related to fertility enhancing surgery. So I keenly involved in the particular for the tubal microsurgery. The one of the incidents is happen actually. I applied for the tubal microsurgery training from the one of the center from Ahmedabad. This is one of the very eminent center for the tubal microsurgery. But somehow I couldn't get the admission in the particular this one. But I accepted the challenge. I want to do the tubal microsurgery, and that's why I started with a couple of cases we do with the open surgery. And Dr. Narayan Bhai Patel is bring the instrument from the me. At that time, the Kalilkar people started the Indian instrument for the open microsurgery instrument. But in 1994, I attempted with the 6.0 with the single chips camera. Actually, I started with the industrial camera, but meanwhile, in the couple of months, I think I got the Lemke camera first. And secondly, I buy the store single chips camera later on, after the 1.5 years later on. But single chips camera with the 5 mm instrument with the 6.0. First, I attempt in 1994 for the tubal microsurgery, and couple of cases we done it. I couldn't succeed, but I think at that time Dr. Ajit Rawal and Dr. Sapna Sa both are, I think, give the moral support to me to do the continuous journey related to tubal microsurgery. And I think I the first I got the result in seven tubal microsurgery, and this is the one of the turning point. And then people is no related to my tubal work, so people is just came to observe, look for my tubal work, and then gradually I think my popularity related to tubal microsurgery will be increased, and I got so many reference. The another one incidents happen, earthquake happen in the western part of the India, particularly in the Bush 2000. At that time, in this year, I crossed the more than 200 tubal microsurgery because childless people is give the request related to this tubal reverse. So this
Oh,
is the one of the thing. Accordingly, me, I think at that time this is the highest series in the world related to tubal microsurgery because I crossed the more than 750 tubal microsurgery between 1994 to the 2001.
huge work, sir. And as we all know, sir, to even today with 3D camera, we quite struggle to do the tubal anastomosis. I can't imagine with the single chip, how could you have performed this initial surgical, like precise surgery? This is very delicate surgery of tubal
I
reanastomosis.
think this is the madness, I tell you, this is the passion toward the work. And I realized that if you involve, suppose आपने बाहुबली सर फिल्म देखते हो, if the first part of the Bahubali is finished after 3 hours, you feel that might be it's the second part is started. So it's the 3 hours is like for the 10 minutes for the you. The same thing is happening in my life. If I involve in the endoscopy for the work, and I realize that it's the really meditation for the me. And I think I feel that this is the things I think give the inner joy and happiness to the my life, and I do the more and better work for the work for laparoscopic surgery.
Amazing. Sir, also you have performed Asia's first laparoscopic birthings, right? So, where do you get this courage? Is this the business heart or
No,
or
basically, I am from the Cancer Institute, from the MPSA Cancer Institute. I passed my MD from the Cancer Institute. So I know the exposure of the open radical hysterectomy. And even though I joined in the Lions Hospital, Mehsana, at that time, the lot of cases refer from the Rajasthan belt. This one is the belt for the CA cervix, I think. So I think I crossed the more than 150 open radical hysterectomy, and then I feel that but let's I start with this laparoscopically. At that time, only the bipolar and monopolar is available. No harmonic, no liver vessel sealing, nothing else. But due to my anatomical concept, and I trained in the Cancer Institute, I attempt in 97. I removed the entire specimen and block uh, in without lymphadenectomy in 97, and 23rd April 1998, I do the laparoscopic specimen removal, also lymphadenectomy. Both the things I finish in the 98. And that's why I write down 97 and 98. So half of the job I done in the 97 and half of the job I done in the 98. So this is the basically we done with the single chip camera with the monopolar and bipolar. And even though gradually I realized that due to this cavitational effect, due to this CO2, I think the dissection is much more easy compared to this open surgery. And I think it is one of the temptation I get it. But what's happened? I think I crossed the 3, 4, 5, 6, 7 cases of the laparoscopic radical hysterectomy. It looks like monotonous for me. So I think I'm not enjoying with this same. It's like the mathematics. If you do the 10 surgery of the radical hysterectomy, then it's a monotonous workflow. So I couldn't enjoy this one. So I think the enjoyment I get with the adenoma and endometriosis surgery.
always eager to do something new, some getting more challenges once you are master, that has become no more enjoyment for you, sir. It's so wonderful to know, and you must have faced many challenges to come across this from the 1997 till this is we are coming to the 2027 now. So it must be a very challenging journey. So, were you have faced any like financial challenges, patient counseling challenging, the setup of the, the your laparoscopic setup, getting the instrument right, getting the training right? So, can
At that
you?
time, there is no training center in the world for the laparoscopic surgery. Professor Kurt Samy started the training center in very late. I think Prasant is one of the first guy to train under the Kurt Sam and Lilo Watler. But overall, there is no advanced training center in the world. Even though myself, I do the surgery and I visited so many other centers, I realized that I do the much more better and more advanced work than the other people. But I think at that time I am in the very small town, and it's very difficult to even to showcase my skill and everything. I get the one opportunity in the internationally. I am famous due to my tubal microsurgery work, but I got the internationally operate in the 2005, most probably, in a hotel Radisson. This is IST event. And suddenly I think people is know my skill and everything. Then people is realize that he is the different one than the other. So I think in the beginning I am just like the bathroom singer. What I am do it. No one can knows related to my work and everything. This is the fact story I tell you. If I tell to the anybody, I do the radical hysterectomy, I do the microsurgery, no one can ready to accept me. But then I started to do the small presentations in any conferences. This is 7 minute video. I put for the radical hysterectomy. I put for the wall suspension for the tubal microsurgery. So these things gradually people is now related to my work. Second, I am in the very small town, and I started my work in the Lions Hospital. This is the tertiary care center, and so many cases I get in the particular Lions Institute. So I think it's a free hand for me to do the laparoscopy work in these institutes. And I think this is the one of the things I think it's changed entire scenario related to my life.
So very complex surgeries you have been performing, microsurgery, adenomyoma resections, and even endometriosis, advanced cases, bowel resections. So what have been your like guiding principle when you're pushing your boundaries every time you try to be better from the previous case and you excel ultimately to the level where we all look up to you and we try to copy paste or maybe to follow your logics and to treat the patient. So what is your guiding force for all this? How you get this everyday energy to keep on improving yourself?
Actually, I try to stretch myself. Actually, I do the one surgery. Always in the second time, I feel that I do the better than my first surgery. This is the one of the force. Second important point. This is karmane vadikaraste, karma yoga. I strongly believe in this karma yoga, and I feel that if you do the continuously, because it's just like craftsmanship. If you do the continuous more and more, you become the more refreshed every time. The same thing is happen in my life. If I concentrated for the surgery, I do the always better than the previous surgery. So always try to stretch myself, and I cross the always try to make the cross the boundary. And this boundary I learned from the endometriosis cases. Because what's happened previously, we do the cystectomy, we do the adenolysis, and I think it's not give the good fertility outcome. Sometimes patient is happy to carry the pregnancy, but the pain is there because we leave the entire disease and everything. So first time I realized that whatever I do, this is not the right approach for the patient. So we started to think on the different way rather than just do the adenolysis and removal of the chocolate cysts. We focus for the removal of the disease, and this is the game changer of the entire my life. I spent the 2.5 decades to understand and learn for the endometriosis, but still feel today I learn the peanuts, nothing else. But I think certain things because I invented the peritoneotomy, and I realized that the multiple implants over this peritoneum and the rectovaginal plate is involvement. If I remove the entire rectovaginal plate and affected peritoneum, this is we call the Mayflower butterfly technique. So it's improve the fertility part, not only the improve the fertility, but recurrence is late. The patient is happy with the enjoying the good quality life, pain is less, dysmenorrhea is less. So I think this is the concept. At the time, no one can, because lot of controversies related to endometriosis surgery. And even though this is fighting between the IVF and endoscopy. So IVF people is think to preserve the ovary. So many things, fulgurations and laser and everything. But I strongly believe that the cystectomy is the gold standard, particular for this one. And whatever the disease, the first surgery we try to make the remove it. And this concept is give the better and better result in cases of the endometriosis. Second thing, if you do the 100 cases of the endometriosis, all the 100 cases is different. So it's give the challenging for me. And this is not the monotonous work for me. So I am enjoying this work and I'm more involved in the endometriosis and adenoma specifically, particularly. And then I gradually, I think, leave the tubal microsurgery and cancer surgery. But still today, I am very happy with the endometriosis work.
It's a now the tertiary referral center for endometriosis. So, sir, you have trained almost more than 2,000 gynecologists for this and laparoscopy over these 2 decades. So, according to you, what defines you are truly a good surgeon, a good student? Like their skill, their mindset, or the mentorship that defines their excellency in future?
I think one of the proper teaching and training is the one of the part. A part of that, I think, surgical skill is sometimes we consider to be God gifted because we look the so many people is very bright, gold medalist or very intelligence in the theoretical part, but on the surgical part, sometimes I think it's the craftsmanship. Like the Michelangelo is, I think, different one. He just draw the anything. The same thing, I think, surgery. Even though I tell you I'm the most discarded guy in the field of medicines, but I think I get the such kind of the subject. It's like to be me, like the 3 Ds. वो काम नहीं रहा काम वो गम्मत बन गई बराबर मेरे लिए. So I think sometimes rather than the intelligent students, I think more important is the craftsmanship is very important for the surgical aspect.
One has to find out the perfect match or the perfect match field for the each surgeon. We may be good at certain, may not be at all for every field. So if you get that proper particular field of your interest, who is waiting for you can excel with your perseverance and hard work. Thank you so much, sir. That is so amazing message you have given to the new generation upcoming, wanted to learn endoscopy. Everyone just usually asks, how much hands-on will you give while coming for the training? So it's not about getting just the hands-on. You find out your passion, you find out the subject which is core to you and which creates interest inside you, which keep on igniting the fire inside you. So that is so amazing. That's a passion. So, sir, minimally access surgery has been evolved tremendously over a period of time. So you have been the witness of entire this from complete open, 100% open to now majority patients we do with the laparoscopy. So from basics to robotics and now the AI assisted procedures are upcoming. So how do you see the future of this gynec endoscopy?
I think now the new generation of people is enjoying with the Mercedes and BMW because 3D is considered to be Mercedes and BMW. In the future, I think Rolls-Royce is coming. It's the robotics. Robotics, I think it's the advantage for the surgeon because you sit together, you never fatigue much more. And second important part, your tremor and everything, I think, rectified with this particular robots. But I think it's still, personally, I believe that is still is the more marketing gimmick right now. And second important part, when you need the tactile sensations, particularly in the endometriosis, sometimes it's a stony hard tissue. The plane of dissection is very difficult. In such cases, I think robotics may be not much more helpful compared to the other surgery, particularly for the radical hysterectomy. I think robot is better, but tubal microsurgery, robot is better one. But for the endometriosis, I think still is the need to need some time for the comment related to
So one day I assume Robo will come and will be trained under you for
it.
endometriosis. So, sir, one more question as someone who has like received numerous awards, national, international recognition, and so much of appreciation, love, and the respect. So, what does true professional satisfaction mean to you?
I think rather than the money, I feel that for us, for the female, the diamond is the different one. You wearing the rings or wearing the particularly uh, uh, necklace. I think it's a different story. For me, I think personally, I believe that endoscopy instrument is really diamond for the me. And my OT operations theater and my entire team is considered to be really a magic hand. See, it's a particular, this is the teamwork. I think it's like the musical party, nothing else. So it's the involvement of the everybody. What you get the advantage with the laparoscopic, if you do the open surgery, only the surgeon and first assistant know the everything. But in the laparoscopy, everybody is involved. And after the 3D, I think people is wearing the glass of the 3D. Just you feel that you are remain inside the inside and you perform the surgery. So this is the entire team is involved in the particular this disease, and it gives the really inner joy and happiness for the me.
So for you, the OT or your battlefield is
Yes.
your immensely satisfying place, or maybe your, as you said, it's a meditation place for you. So after achieving so much, what continues to motivate and excite you about the surgery? Like teaching every day or operating every day?
I think teaching is the one of because it's the patient's problem. In our institute, we never charge for the any teaching programs except the SESBIC course because this charge is not taken by us. This is taken by the AGL and IAG. Otherwise, even though in the fellowship program is absolutely free, and we give the stipend of the 50,000 rupees to the each fellow. This is also one of the story behind me. If you have the time permit, then I tell you.
Yes, yes, please, please.
Actually, in the beginning of my career, my salary is only 4,200 rupees in 1992 when I joined in the Lions Hospital. And I took the transvaginal sonography training with the M.Y. Rawal side at Mumbai. At the same time, other mangoes is came for in the Harkishan Das for the hysteroscopic training program for the 3 days. And Victor Goel is also came in the Bombay hospital. I think Dr. Sadhna Desai is invited this Dr. Victor Goel for the open microsurgery. So this is the entire 15 or 20 days training program. And I spent the more than 50,000 rupees at that time. So 50,000 is the huge amount money. This is the 1 year salary for the me. And I have the at that time Smith with me, a small kid, 1 year old. So even though you couldn't say to your daddy to give the money for that once you pass the MD. So I borrowed the money from my friend and I realized that I think it's required 2 years to give back this money to the all my friends. So at that time I decided and I realized that in my institutes training is absolutely free and I not take any single amount of the money for the training program.
Oh, sir, this is something I never knew. And thank you so much for training me as well in my initial career days. And I have been observing you operating bad endometriosis and multiple fibroids, that African lady for like 6 hours and 8 hours surgery, and with all the equal zeal at the end of the day. So I'm really great, and my perspective towards Dr. Sanjay Patel has changed greatly today. Sir, if uh, time is still there, so if you permit, would like to have some rapid fire questions, like a short answer
Before that, I
questions.
tell you the one story.
Okay.
Actually, my English is not good. So in the 2003, I shifted from Mehsana to the Ahmedabad. I built up the Mayflower Hospital. I feel that because at that time I received so many international invitations. So I feel that I try to make the rectified my English and grammatical mistake I try to make avoid it. So at the time I do my surgery at late evening up to the 2:30, 3 o'clock midnight. I leave my OT at not before 2:30 or 3 o'clock midnight. And 6 o'clock started Dipti's English speaking classes is very popular in Ahmedabad. So I joined it. I hide my entity, and every day I am late. So this is the 10 rupees, I think, particular penalty if you are late. So every day I put the 10 rupees. On the fourth day, I put the 100 rupees. Then madam has realized that I think he is a different kind of the guy. See, quite related to me. And one day she one day she told me, better you meet after these classes. Once I enter in the office, may I coming, madam? Madam is told that Dr. Sanjay Patel, couldn't require any English. Your name is enough for that.
You know.
Okay, and I also one incident happened in the Taiwan because I think this is APAG event, and Long Lee is invited me in this APAG event, and my talk is related to tubal microsurgery. So entire night I try to make the mumming of my lectures to avoid the grammatical mistakes. But at that time, uh, only Professor Rudy from the Royal College, he is the grandson of the Professor Love, and myself, only two people is delivering the English and couple of other people. Rest of the people, Japanese people in the Japanese language, Chinese people in the Chinese language, and South Korean in the South Korean language, he delivered the talk. And I realized that language is not the barrier for the life. So this is the one of the turning point. And then I, even though I give the big lecture, oration and everything in the international forum without any fear, for 1 hour, 2 hour, for the 3 hours. Even though I am the one of the affiliated with the training program of European School of Gynecology. So at that time, one of the tutorial is more than 3 hours, and constantly 3 hours we speak. So people is need the material related to surgery, material related to subject, not related to your language. And
And
whatever the way you, if you try to transfer it, you try to make the explain it. I think this is the best part. So language is the different one. I think this is the phobia people is kept in mind, even though I have the phobia related to this one. But these two incidences break in my mind related to language.
so wonderful. Your English teacher might be the proudest one, having the student achieving so many accolades internationally, and though being failed in her subject. So wonderful to know the story behind your this confidence and the, we all face the stage fear once or in a lifetime. So, sir, teaching or operating, if you need to choose one, what it would be?
Teaching. You always learn from the teaching, because your teaching is the really teacher for the you.
Wow, sir, that's so true from heart. So, most memorable compliment a patient or student has given to you.
If I perform the endometriosis surgery and patient is carry the pregnancy after so many IVF failed, I think this one is give the memorable event for the me.
Wow, that's true.
And
Endometriosis is
this
really
patient
a
is
challenge.
carry the natural pregnancy, normal pregnancy after surgery. Even the
Oh,
30% patient in our institute, those who multiple time IVF failure, and we underwent go for the surgery and patient is carrying the natural normal pregnancy. If AMH level is more than 0.5 only.
so that's really a miraculous, and it's the best surgeons, the corrective surgeries and along with the good wishes to the patients, prayers worked. Sir, if not a surgeon, what would you be? Like not a diamond merchant, anything else?
I think personally, after the long 3 decades, I realized that my life is made for the laparoscopy. I am the guy innerly, if I think that this is the, because God is given assigned work to the me to I perform the such kind of the surgery. And thanks to the God, thanks to the Almighty, there is a definitely there is a no shortcut for any hard work. I do them even though in the beginning of my career, my sleep pattern is not more than 2.5 to 3 hours. I work more than 16 to 18 hours. But this all the energy I get from my work. That's why I'm calling your work is like your worksheet. Your work is our meditations.
Correct. So you are not tired of work. You are getting energy out of doing more and more surgeries. So you are so young yet with the young heart. And recently you have been to this Mansarovar Yatra with this. That is shows your physical stamina as well. So nowadays, as you have seen, yeah, generation, Gen Z is coming up, young gynecologists are coming up. So we all know they are different than the many of the uh, there is a generation gap definitely. But what is the best quality you observe in it that impress you?
I think it's we are the dumb people. Our journey is very long. We require so many years because there is no guiding pathway for us. Newcomers get all the platform, YouTube, people is anything if you want immediately you look it. Second, the gadgets, the different kind of the gadgets. I think it's you make your journey so easy. So we need the 20 years to learn. The new generation is pick up within the 5 years. So I think definitely it's maybe the generations game, the new people is much more smarter and more faster learner than the us. Maybe.
Correct. They are so
But one
techno
of the
savvy.
messages for the new people, very aggressive
Yeah.
and very shortcut. I tell you because it's considered to be crime in the medical professions. Shortcut is really crime because what we spend the 3 decades to understand one subject, still we are feel that we are very shallow. Young people, whatever they do the comment. Previously, any comment we do it, we do the 200, 300 cases of series, and then we do the any comment on the audience, August audience. We never speak. Even the adenoma resection I spoke in the 2003, the series is 438 cases. Sadhna madam is told that Sanjay had the surgical mind and that's why he told for the adenoma resection. There is no place of the surgically correction of the adenoma resection. But Sejal, uh, we do the tremendous work behind this adenoma resection. Then we speak. After a couple of years, I think people is realized that Sanjay is absolutely right. My dear friend, late Ornella CG, and she, I think, publish the first paper related to adenoma resection in 2007. With the 7 centers, she accumulated the cases of the 55 cases series, and she proved that definitely, there is a place of the adenoma resection in the fertility aspect. If the localized adenoma also improve the pain factor, and its patient is relieved from the menorrhagia. So I think whatever we tell the any sentence, I think we work hard and then we speak. Now, Ordila is also telling the one of the things in AGL event in the audience. I think Sanjay is 10 years ago than this. Whatever he told that might be in the future is the golden sentence for us. I think this is the words of the Ornila Singh on the AGL in the during the time of her talk.
Oh. That's is the what we call the genius who thinks out of the box and maybe at that time of generation won't be able to understand it thoroughly. But definitely there is a scope to understand it much more deeper and we come to know that it is a true
One message is very important, Sejal, if you permit, I tell you.
yes, sir.
I think in endometriosis, people is very radical. Before 2017, we are also very radical. And we realize that treatment should not be worsened than disease.
Correct.
And I think now we change our entire treatment plan. Now we more organ sparing surgery, more conservative surgery. And we realize that it's reduced the morbidity, mortality, and complications. So I think it's one of the take-home message for the new people. Bowel resection is the end. It's the indicated cases. I think whenever it's possible, try to do the saving or disposal. I think it reduce the morbidity and even the complications rate is particularly related to this surgery.
Yeah, as our oath says, premium non nocere. Let's do no harm first. So very well concluded, sir. And I'm really grateful and honored to have you here. It's a wonderful conversation and would like to watch it again and again. And I hope our viewers would also love to listen to you. Will inspire from your experience and your stories. and would like to have you again on the similar platform, sir. Thank you so much.
Thank you, Sejal.
And
Thank you,
thank you,
Sejal.
I would like to thank Dr. Sunita Tandulwadkar ma'am once again.
And convey my regard to the Dr. Sunita. She is very dear friend of mine. And I think we worked together more than 3 decades in the Fogsi, IAG, ISA, all three formats we worked since 1994 to the till date.
Yes. So we are so grateful. Madam has provided us this wonderful platform for one-to-one conversation. And Evangel team, thank you so much for your technical support, and thank you to all our viewers. Have a good night, sir, and thank you so much.
Good night. Good night. Thank you. And convey my regard to the Sunita for giving me opportunity for this podcast. Okay.
Sure, sir,
Okay.
definitely.
Okay.
Thank you.
Thank
Thank you.
you. Thank you.